This is a 58-year-old woman who's had a couple of kids and came to see me because she does not like the extra skin of her tummy. She also has an umbilical hernia inside of her belly button as well. So the plan is to perform a tummy tuck as well as an umbilical hernia repair. Here are her markings for the surgery. I'm going to make an incision. It's going to be nice and low on her tummy, and the goal is to remove everything between the pubic area and the belly button up there. We're also going to do some liposuction of the hips, and she's got a bit of a hernia of her belly button right here as well. So the general surgeon's going to help us fix that up. All right, her surgery is all done. Everything went really well. We took all that extra skin that I had marked off of her. These little wrinkles and grooves, that's all going to go away as the swelling comes down. And we fixed her hernia as well. There's a drain and a pain pump, and we'll take those out in her first postoperative appointment. Here's the skin that we took off of her. You can see there's a lot. There's the fat underneath it. That's the overlying skin. A couple little incisions here and here where I did the liposuction through. All right, we are almost 2 months out, and she's healing really, really well. You can see she has a little scar around her belly button. There's also a little scar that goes from hip to hip that's healing very nicely. Her tummy is real flat. She's still a little bit swollen, and that swelling is going to continue to improve over the next few months.